intraoral scanners came out, they were big, they were clunky, they took a long time to take a scan, and most of us in the dental profession thought of it as a replacement for alginate. In fact, we even called it an optical impression instead of a scan. And today, many generations of scanners later, the scanner has evolved from being an optical impression to really a diagnostic tool, as well as a dental record. A scan is a dental record when we think about it. And now we use the scanner for diagnosis. We link it to a software for treatment planning and to simulate the outcomes for the patients. We use it to track treatment for the patient. And then for general dentists, they could routinely use a scanner to monitor things like gingival recession or abnormal tooth wear. Really, I'm so excited to have this tool in my practice. It's like the best thing that ever happened. The patients are so wowed by the scanner technology to begin with. As soon as they walk in, before they see the doctor, they get a new patient scan, and my treatment coordinator pulls up the simulated outcome on the scanner. And I have patients who actually touch the screen on the scanner, little kids, turning the teeth around to look at their teeth. And then I come in and I'll talk to them. I said, wow, look at your teeth, look at the one that's sticking out. And immediately they can visualize what their main concern is. And when the doctor points out their main concern on the screen, they immediately connect with the doctor and say, wow, this doctor understands what my main issue is, and she's going to show me how she's going to fix it using the outcome simulator. And then while I'm doing a clinical exam, we go back to the viewer, and then I'll show them the intraoral scan itself, where they can see if they have large restorations, if they have chipped teeth or broken teeth, that shows up. It's like an intraoral camera. And then we look through the occlusal contacts, as well as using the NIRI feature. I'll do a very quick screen with the NIRI feature right in front of them, and then we'll say, we're going to look and see if you've had tooth decay. When's your last checkup with the dentist? And of course, with COVID, many patients haven't been able to get in even for a cleaning. And they'll say, it was 9 months ago, it was 12 months ago I saw my dentist. And we're able to very readily screen them for caries. On top of that, if we do find something on the NIRI feature, I can take a screenshot, and then I will actually email that screenshot to the referring dentist and say, please restore the following teeth. Upper right first premolar on the distal surface, there's a caries lesion. I send them the screenshot, and they can see exactly where that lesion is. Well, this is very exciting too as an orthodontist. Sometimes you wonder and worry if the treatment's happening according to the plan, right? The teeth seem to be moving, or sometimes the teeth are not moving, and you're thinking, oh, is it my imagination, or is that posterior molar starting to tip? So we will actually take another scan, and we can use something called a progress tracking feature on the iTero scanner, where we compare the stage of tooth movement with where they are on the ClinCheck software. And then we can monitor it, and the scanner will tell us if the teeth are moving according to the tooth movements that's been programmed into the software. So for example, teeth that are moving according to the plan are green, and if the majority of teeth are green, then we know it's working according to the plan. Now, this is more important as many orthodontists now are attempting to treat more and more complex cases with clear aligners. And if a treatment is going to go longer than a year, always at the 1 year mark, I'm going to take a scan and I'm going to check which teeth are moving according to the plan and which are not moving according to the plan. So for example, if you're an orthodontist, you've never done a premolar extraction case with clear aligners, this is your first case, and you're kind of nervous. How is it going to work out compared to fixed braces? Well, you could be doing a scan every 3 months and comparing it against that progress tracking feature to see how well the teeth are moving according to the plan. The other thing that we look at while treatment is in progress is perhaps a gingival recession. There are some periodontally compromised patients. We're very concerned about recession getting worse. And for these patients, it's not just the clear aligner patients. We can take a scan for fixed braces patients, use the time-lapse feature, and we can see if there have been any changes in the gingival recession or not. So that to me is an amazing feature, because sometimes patients present with pre-existing gingival recession, and both the patient as well as the doctor, we're very concerned that this gingival recession should not get worse during the course of treatment. And so that time-lapse feature is a great tool for superimposing two scans taken at different periods of time and allowing us to see if there have been changes in the gingival margin or not. Well, the first thing is, I have referring dentists who perhaps need to make a very simple dental appliance, but the patient's a gagger, and they don't own an iTero scanner. So sometimes these patients get sent to our office because we own a scanner, and the dentist will say, patient's a gagger, unable to take impressions, please can you take a scan and make a very simple, maybe lingual holding arch or a night guard for the patient, but for the simple reason that the patient is not able to tolerate impressions. So that's one way. And the other way too is to send them screenshots of the work we're doing and the findings on the scanner. Everything can be screenshot and sent in an email to the dentist to keep that communication going. Oftentimes, I will do a mock-up of the teeth setup. Perhaps a patient requires a veneer on their front teeth, post-orthodontics, and we can take a scan, send it to the referring dentist and say, now, these are where the teeth are at this point in time. Do you need me to move it this way or that way? Or bonding for a peck-shaped lateral, is the space enough? And we can actually do annotations on the scan. We can mark up the scan and circle the teeth that we're looking at. So, I mean, for me, it's very exciting because rather than in the old days, we would write something on a slip of paper, but now it's more visual communication, it's digital communication, and it really facilitates, that communication between not only the two providers, the restorative dentist and the orthodontist, but also it's to the patient's benefit, because then the outcomes are going to be so much better when both the dentists can communicate and be on the same page with regards to that one particular patient. Well, this was the year that changed all our lives, not only just those of us in the dental profession, but entirely the whole world, all our patients' lives, everyone was changed. And I think that from now on, we're going to do dentistry very differently. In fact, I think if you look on the positive side, it really has pushed us 5 years into the future to take this digital and virtual leap forward in the way we practice medicine and dentistry. For example, in our healthcare system, we didn't even have a billing code for virtual medical appointments. And now the Ministry of Health created this billing code so that doctors can now do remote consultations with their patients. And so even in dentistry, what we've done is we've gone more virtual and we've gone more digital. And those are really the two key words. We've always been digital in terms of scanning, treatment planning on the digital software, creating a digital orthodontic appliance like Invisalign clear aligners. But now, not only we've gone digital, we've also gone virtual in terms of our appointments. We've taken 20% of the appointments in our practice virtually. So if you called me today, you don't have to wait 2 or 3 weeks to come in for a new patient consultation. We'll schedule you within 2 days for a virtual new patient consultation to meet the doctor online. You can talk to the doctor about what your main issues are. You feel that the doctor's really listening to you, because oftentimes when the patient's physically in the office, we're so busy looking at their teeth, right? But now on Zoom, the patient feels like the doctor's really listening to me. They're understanding what my problem is, what I would like to get out of the orthodontic treatment. And by having the patient smile and show their teeth to me through the webcam, I would say 90% of the time, I can see what the issue is. I can give them a rough idea. And if I can, I might be, wow, that's a lot of crooked teeth. We may have to take some teeth out. We'll tell you that when you come in to meet us in person. And so that new patient consult is virtual. Growth checks are virtual. Little kids where we've done a phase 1 treatment, we're waiting for baby teeth to fall out, waiting for them to transition into the permanent dentition before we do a second phase of treatment. All those growth checks are now virtual, because all we need to do is, do you have any more baby teeth left in your mouth? How tall have you grown in the last year, Johnny? You know, have you started growing through your puberty growth spurt yet? And these are things we can easily track virtually. And then we actually also do virtual mid-treatment appointments for our aligner patients. We have patients who are trapped across borders who can't come back to Canada. They're in the US, they're in China, they're in Taiwan, and these patients are concerned, how is their treatment progressing? And I'm concerned as a doctor. So we set up a Zoom appointment for them where they can show us their aligner fit. They can actually take photos of their teeth with the aligners on using their mobile phone camera, and they can upload it to the Invisalign app. And then I can view those photos through the Invisalign app. And then we can say, wear your aligners longer before you change up. Or we can say, everything's looking good, keep doing what you're doing. Or we might say, you're a little behind on your elastic wear. Have you run out of elastics yet? Can we send you some elastics in the mail to wear? So virtual care, I think, is easier than it thinks. And, you know, there used to be a part of resistance on the part of the doctor. I would feel very insecure if I didn't see a patient face to face. And there was a resistance also on the part of the patient, because they felt, man, I paid a lot of money for this treatment. I want to come in and see the doctor, right? But what the pandemic did was break down those barriers, both in the doctor's head and in the patient's head. The kids are all doing virtual school or have been through a period where they've done virtual school, and now they're slowly integrating back into the school system. So it's not a huge leap for both the patient now and the doctor to be able to do these virtual appointments and connect virtually, whether it's through my Invisalign app, through virtual care. And Invisalign also has a website called Smile Consult through Invisalign, where we upload the patient's name and email, and actually Invisalign will send the patient a Zoom invitation. And then every day we launch Smile Consult, and it has a calendar, and I can see, oh, today I have the following 8 virtual appointments. And what happens is, at the time of the virtual appointment, my appointment scheduling coordinator, she'll pull the patient up on Zoom, and then she's just going to run and get me, Dr. Tai, virtual patient, you know, and then I'll run to the computer, do the virtual meet and greet with the patient, whatever that could be a retainer check, it could be a new patient consultation, it could be a growth check, it could be a monitoring check, and then we're able to just treat that patient like as though they were really in the office, but on the webcam. We have patients who are immunocompromised. You know, there's some patients who are older patients, they have heart issues and so on. They don't want to be out in a medical facility at a time like this. And we're also doing virtual appointments for those groups of patients as well. And now mom doesn't have to drag every sibling into the office just because one person has an orthodontic appointment when we can do it virtually. And what I like about the virtual consults is, you know, dad's logging on from his office, mom's at home, she's got one kid on the lap, you know, she's got the patient standing next to the webcam because he's a little older, he's the one who's thinking about getting braces, and different members of the family will log on from different locations and be able to participate in the consultation and the discussion together with the doctor. So that's, for me, that's really amazing. Yes, and here you can see I have different translations of the book behind me. And this is the book. It actually looks like a coffee table book cover, doesn't it? I remember when we designed the cover, and I knew it was going to be a dental textbook. And I've looked at, if you've seen any dental textbooks, invariably they have teeth, radiographs, gingiva. And I said, none of that on my book cover. I just want a very simple graphic of the aligner in very modern colors. And in fact, many of my referring dentists own a copy of the book, and they keep it in their dental reception area because it does look like a coffee table book. So what motivated me to write the book was there was such a lack of information on clear aligner treatment. There was really no go-to source to learn how to do clear aligners. We could attend courses, but a course might be on one topic, how to treat deep bites, or class 2 treatment. But we don't just treat class 2 deep bites in our practice. We have all types of different malocclusions that come into our office, and there was no comprehensive go-to handbook. So finally, I decided, I used to lecture everywhere. People would say, what book can I read? And my graduate students would say, what's the recommended text for this course? And I'm like, there's none. We're desperately trying to pull a few publications here and there. Many of the publications were outdated, and they didn't reflect the clear aligner appliance of today. And so I glibly said, I'll write one. And finally, a real labor of love. And I want to thank the people who encouraged me and all the doctors from around the world who kept asking me for a book. So finally, we wrote the book. And, I did this for legacy, I think. For me, it's very important. How are we going to leave a legacy to the people in our profession? And this was more for legacy than anything. And, I think not just orthodontists, but every dental practitioner who does clear aligners should have this book on their shelf, because it's designed to be a clinical handbook. You and I, we know we hate reading textbooks. So the other thing about the book is that there's lots of pictures in the book and lots of tables where we summarize the things we're talking about in the book. It's written for people with short attention spans. And it's written so that you don't have to read it on page 1 to page 320, but it's written as a reference book. For example, you have an adult patient come into your practice and you're thinking, I think I need to extract a low incisor. That's going to be a tricky thing. How do I do that? What do I design into the software? What attachments do I need? What do I need to do to finish up the case? So you would turn to the chapter on low incisor extraction. You would read through it. It will tell you how to decide which tooth to extract, how to design the ClinCheck, what type of attachments you need, how to clinically execute the treatment. For example, take a progress panoramic radiograph after you finish your first series of aligners to make sure you have parallel roots before you make additional aligners. And then there'll be 3 case reports in the book, so you can see how these type of treatments are going to work out within the book. Maybe you're, a restorative dentist who dabbles in some Invisalign, and suddenly today a patient walked in and you needed to prepare a site for implant placement. And you might, okay, I just need 2 more millimeters or 3 more millimeters of space. Instead of referring the patient to a specialist, maybe I'm thinking that I'm going to try this with aligners. How do I prepare an implant site? Well, that's in chapter 15 of the book. It will tell you how to prepare an implant site, how to measure that space on the software, how to make sure your roots are parallel, and how to incorporate perhaps a pontic for a missing tooth into the aligner while the treatment is in progress. So our patients never go toothless when they're wearing aligners while waiting for their restorative treatment to be completed.